Good evening, everybody. You're so welcome to the Royal College of Physicians of Ireland Diploma in Women's Health. We're absolutely delighted to have so many on this evening. Thank you for taking time out of your busy schedule. It will be a very simple running order this evening. I'm going to hand you over to our Director of Academic Affairs, and that's Mr. Dermot Brannock, who is going to run through the programmatic overview, and that is the curriculum, time commitments, tuition fees, recognition, and just the general Q&A that will be asked. Having said that, if you have any additional questions or queries throughout this webinar, we really do invite open chat and questions and discussion on the chat button in the center of the screen beneath. So please feel free to go ahead and use that. Without further delay, I'm going to hand you over to Dermot to commence the presentation.
Thanks a million, Rebecca. And yeah, it is brilliant to see so many people here this evening. This program is only launched a short while and proving to be extraordinarily popular. So I'm going to share screen and bring you through a walkthrough of hopefully everything you need to know about the program to make a decision to enroll. We'll go through the structure of the program, the objectives, what the learning experience is like, and what involvement in the program will look and feel like. As Rebecca has said, if there's any questions as we go along, just pop them in chat, which is on the bottom middle of your screen, and either I'll answer them in real time, or the team will answer them, or we'll get back to them at the end. So yeah, fantastic to have everyone here. One of the things that you will notice about this program is you'll see iheed sitting alongside the College of Physicians logo. And the College of Physicians need little introduction, but we probably do to most people. So iheed are an Irish company. We're founded by a family doctor from Tipperary, Dr. Tom O'Callaghan, and we have been working in the medical education space since 2013. We're now part of Cambridge Education Group. Effectively, we work with universities, with health ministries across the Middle East and South Asia, and we've done an awful lot of work in capacity development, in family medicine, in women's health, and then since 2015, we've been working with the Royal College of Physicians. We've been working with the University of Warwick and other Irish and UK institutions to bring their qualifications to a global audience. And across our suite of programs, this is everything from CPD up to masters and residency programs. We've 400,000 completions on our online learning environment that we've created. So really what we bring to the table is a very deep knowledge of part-time professional medical education. The College of Physicians need very little introduction. 1654, they were founded, for any of our colleagues that are on the call from outside of Ireland. The Institute of Obstetrics and Gynecology was established in 1968, and they are, they are in charge of and oversee all of the membership exams like the RCPI in obstetrics and gynecology, and of specialist training in obstetrics and gynecology. And for those in Ireland, you'll have seen them in the news quite a bit about COVID-19 vaccines for pregnant women and things like that. So they're one of the 7 colleges of the College of or 7 institutes of the College of Physicians, and they have overseen the development of the curriculum and of this program. I think it's always worth at the outset kind of setting up why a program has come into existence, and whether you train in obstetrics or gynecology in the UK or Ireland or a similar jurisdiction. It's you're looking at about an 8-year journey to become a consultant obstetrician or gynecologist. And what we have developed, obviously, is a 6-month qualification. And this diploma in women's health it's really aimed at doctors that are working in primary care, trainees that are at the early stages of specialist training, or experienced practitioners that are looking for a refresher or a formal qualification. So this this will provide a really solid foundation for lots of areas in obstetrics and gynecology under the umbrella of women's health that we're talking about. So what this program is trying to do, and you can see the program level learning outcomes on the screen, but really the curriculum is designed to give a really comprehensive introduction to the breadth and depth of issues within women's health. It's also, because it's an interprofessional program, it's looking at how obs and gynae functions across primary, secondary, and tertiary care, and how we'll work within multidisciplinary teams. And we'll be doing that through a really, really, stimulating online learning environment. It's tutor-led, and I think that's really important. There's a lot of, there's obviously membership exams that people can do, but they differ quite a lot from a taught program, which has a tutor-led and group experience. So, we think that the actual learning experience on the program is as valuable as the exams and the content itself. And it's all, it's looking at everything here in light of, latest evidence, and the course content is absolutely the most up-to-date you can get. So what we're looking at in terms of the award then is, apologies, that says pediatrics from a previous presentation, but it's a diploma in women's health from the College of Physicians, and that is an academic qualification. It's recognized worldwide. You do get CPD awarded with it, so it's the Royal College will grant 44 hours of CPD. Depending on the jurisdiction that you're in, some regulators will grant 36 hours, some will grant 96 hours, and they are standardized amounts of CPD that they give for postgraduate studies. So it all depends on what country you're in, but what the RCPI will give you will be 44 hours. In terms of how the program is structured, so there's 21 weeks of taught content, and there are discrete topics to each week, and we've structured it into roughly 50-50 for obstetrics and gynecology across 4 modules. And you can see here the content coverage in terms of what each of the modules are doing, and the depending on the group, and most people on this call are going to be looking at the European group. So effectively, we'll start off with an induction evening on the 25th of November, and then we'll spend the first 5 weeks of the program looking at history taking, examination, and communication in obstetrics. We'll do 2 weeks of physiology and embryology. We'll do anatomy. We'll do drugs in pregnancy, and I'll speak about the assessments in a couple of minutes. And then when we come back into the second obstetrics block, we're looking very much, all of this is looking at through the lens of patient management, but we're getting into early pregnancy, routine antenatal care, complications, and then high risk maternal medicine, labor, birth, and postnatal care. So we're doing a very broad overview of areas of obstetrics. What you're looking at in terms of the weekly structure is, so each week has its own topic, and the week will begin on a Monday. You'll be studying this topic during the week, and then depending on the group that you're in, you'll have your tutorial session either on a Thursday evening or a Friday morning, or this is a global program, so the people in Malaysia, for example, that will be a Friday evening for them. So we move on then after March into the second block of into gynecology, and apologies, that's after, hang on, sorry, bear with me for 1 second while I bring this up. But effectively, we're following the exact same structure for gynecology, where we'll have 4 initial weeks of gynecology, followed by a break, and then followed by a further 5 weeks. So there's 21 teaching weeks in totality. So bear with me 2 seconds. I'm going to open this up and pull it in again. Nothing like mistakes happening live, so apologies. The piece that I'll get onto then, I suppose, is on the assessment as well. Here we go. And I will, sorry, apologies, I'll share screen on this now. So the timetable then for gynecology is we'll come back in April, and we'll start off with menstruation, then contraception, then we'll deal with sexually transmitted diseases, HIV, etc., and then HRT and menopause. We'll take a break for your communications assessment, and then we'll come back for a further 5 weeks of gynecology. So benign gynecology, infertility, incontinence, prolapse, cancer, and then finishing off the last 2 weeks with cancers. And again, you can see the same pattern applies, that the week will start on a Monday, have its own topic, and then the tutorial session, depending on the group you're in, will be on a Thursday or a Friday. So I'll go back to the presentation now. So what that looks and feels like in terms of structure then is we'll start each week with a discussion post, and that discussion post will be a clinical case that will present, so someone will have a presenting issue, and it will ask you as a group, and you'll be in groups of 25, it'll ask you as a group to debate what the next appropriate steps are in, investigation, diagnosis, management, treatment, referral, etc. So you go through, you contribute to that discussion post in your own time during the week. You then you go through the online content similarly in your own time, and the online learning environment really is kind of the heart of the program, and it is an absolutely fantastic learning environment. You can use it on a laptop, a tablet, a mobile. If I'm studying something on my laptop or my mobile on in the office, and I come home and pick it up on my phone, it'll remember where I left off. It's very much focused on patient cases, so it'll bring you through the kind of the theoretical content or the background of something, and then it will get straight into patient case management and really focusing on clinical decision making. And so the online learning experience that you have, you will bring yourself through this during the week in your own time, and then towards the end of the week, so for most of us, it will be a Thursday evening that we'll have our weekly tutorial, and that's where you'll come together in a group of 25 and discuss the practical application of each week's topic with your group. And it'll be led by your tutor, who will be effectively facilitating conversation around, well, how does this present in real life? How do you manage this when you see it? What are the red flags you need to look for? And very much their role is to bring the content to life for you. The tutors are all consultant obstetricians or gynecologists. Some of them are professors in obstetrics, in maternal medicine as well. So, and they're an amazing bunch of tutors that you'll have on the program. And the weekly tutorial, and I think this is one of the things that sets this type of program apart, is that the learning experience, you're with a group, you're meeting them every week, you've got an opportunity to kind of ask questions, to get get answers to queries that you have, to discuss guidance. And actually MacDoom has put a really good question in there, and one of the slides that I put up, actually, this one, it'll show you that what we've done in terms of guidance, because this is an international course, we'll give the RCPI or the HSE guidelines. We'll also give the Royal College in the UK's guidelines and the NICE guidelines where applicable. So you'll be able to debate the differences within those guidelines and why certain ones are there. So the program, the program will be reflective both of an Irish audience. Obviously, it's a College of Physicians of Ireland program, but it is a global program, and it's been written as a global program from the outset. So that's a really, really good question. So you go through this weekly rhythm, and it's very easy to fall into a rhythm of study on this program, and the teaching and learning strategy is well honed at this stage from our other programs with the Royal College as well. So this, you'll spend in a given week, you'll spend probably an hour on the case discussion, you'll spend about an hour on the e-learning content, you'll spend an hour on your tutorial, and then you'll read around the content for an hour or two after that. So you're talking in the region of about 4 or 5 hours a week to participate in the program, and the vast majority of that you can do at your own time and pace. It's only the weekly tutorial on the Thursday evening or the Friday that you have to be somewhere at a specific point in time, and each of those tutorials is recorded and available to you for you to watch afterwards. So lots of people are going to have on-call or shift patterns that will mean they will miss occasional tutorials, and that's absolutely fine. Everything that we do on the program is recorded and available for you to watch back afterwards. The other area where people usually have a strong interest is in the assessment. So the assessment, and I will preface that this is being formalized and signed off by the program board next Monday, but we are 99% certain that this is what the assessment will be. It's split between looking at clinical decision making and looking at communication. So I'll speak about the exam first. So the exams, which are worth 80% of the whole qualification, they are focused on clinical decision making, and they will present you with a series of case vignettes, much like you'll see in the discussion forum every week. And they'll ask you, it'll be single best answer type of questions, and a couple that are very short, kind of bullet point free text answers. And they'll ask you again, what's the next steps in decision making? What's the next investigation, treatment, diagnosis, etc. So the exams very straightforward, and you'll be used to the style of assessment through the discussion forums. The communication skills, again, the college feel that communication skills is a key part of women's health. So what we will do is the first one will be formative in that it won't count towards end of program marks, but we will ask you to effectively enlist the help of an actor, so a friend, a colleague, a family member, to play the role of an expectant mother or gynecological patient. And what you'll do is you'll be given a patient information sheet for them. And if we take the example of the first one, which will be on history taking, the information sheet that your colleague or friend will have will be a range of symptoms and issues, some of which are relevant, some of which are not relevant in no particular logical order, but exactly as a real patient would present to you. And we'll ask you to take out your phone or tablet and simply record you for 5 or 7 minutes taking a structured history with that person. Similarly then, the other ones will talk about explaining a diagnosis or breaking bad news. So really it's trying to ensure that appropriate communication skills are at the heart of the program as well. So the assessment strategy is very much directly linked to the content that you will study each week. The exams are straightforward. We expect, and I think this is important, we expect the vast majority of people to pass the assessments. They're not there to trip you up. They are there simply to reinforce learning and demonstrate that you have the knowledge and skills coming off the program. In terms of actually then, what it feels like to be a learner in the program. The first thing is, you'll be in small groups. So it's groups of 25, and we are taking 3 groups of 25 at the November, at the intake at the end of the month. So you'll be in your group of 25 with your tutor for obstetrics, and then with your tutor for gynecology. So you'll get to know your group very well. You'll get to know your tutor very well. The modules, you know, the pace of the program, again, this delivery model is very well honed in that, you know, having the weekly rhythm, having the tutorial every week, that works very well, and we're confident that the pace of the program is, you know, it's doable in terms of your other clinical commitments. So we think it's about 5 hours a week that you'll spend on the program. You may spend more studying before one of the exams, but you're in reading weeks at that stage where you have nothing else on. So we think that is a reasonable average. And there is a huge amount of support underpinning the program. So, you know, the program leader, and there's an RCPI program leader, Mary Higgins, and an iheed program leader. They are fantastically invested in making sure that the program succeeds and that you have a really positive experience. The tutors, as I said, they're an absolutely amazing bunch. They dedicate themselves really well to the program. They're all hugely skilled clinically, and they've got loads of education experience. The program management team, then, you'll meet the program management team every week at the program. So there'll always be somebody each week that you can ask a question of. So one of the program management team is at the start and the end of every one of your tutorials. And then there's a technical support team, but they tend to be not needed. The platform is very intuitive. It just works. It's very easy to navigate. You can see, you know, it's very visual. It's very interactive, and you know, it's on your phone or tablet. It's an app. On your computer, it's a website, so it's really easy to engage with. So, you know, and that support, it is a key part of the program, as is, you know, the support you'll get from your peers and your tutors. And we think by having the discussion forum at the start of a week and then having the tutorial towards the end of the week, that, you know, you'll get a sense of community. You'll get a sense of being on this journey with someone else, and with a group. So in terms of eligibility, and I see that coming in, so it's open to medical doctors and nurses only. And I saw one of the questions in the chat about where people have their medical qualifications from or registered with Ireland. What we will look for is your MBBS or your MBCHB or your nursing degree. We look at your undergraduate qualification, not necessarily your membership qualification. So effectively it's the bachelor degree that we will look for. You do need to be able to complete the program through English. Now, because, you know, there's obviously no visa requirements to come to Ireland for this program, you're not writing essays, etc. So we don't need a formal English language assessment for this program, but you do need to be able to complete the program through English. And we will assess that through, you'll all have conversations with the education advisors that recruit students onto the programs, but we'll also ask you to write a personal statement of 500 words as part of the application process. The other 2 things that we look for as the application process is your university certificate, so your MBBS degree, etc., and identification. So the application process is really straightforward. In terms of fees, then, so in terms of fees, the fee for the program is €3,000, and you secure a place in the program with the payment of a €500 deposit, which leaves a balance of 2,500. You can either pay that in full, you can split it into 2 payments of 1,250, or you can split it into 4 payments of 625 across the program. We always get asked, are there bursaries or scholarships available? There aren't. The program is set so that it's hopefully affordable and accessible to most people. But
you may be able to get TSS funding though if you're an Irish doctor.
Very true.
Yeah.
Yeah. good intervention, yeah. And lots of people on our other RCPI programs do get TSS funding all the time. So that is a very good point. In terms then, so this is the second of these programs that we've launched with RCPI, and the student experience on the first program that we launched, the Diploma in Pediatrics, where we had that errant slide from previously, that's had 1,000 students on it from 41 countries over. We launched that in March 2020, and there's 92% student engagement, and that is that's looking at the engagement with the materials on the platform and attendance at the weekly tutorials. So it's an incredibly strong statistic, and it shows us two things. One is that, you know, the content and the tutors and the faculty are really, really strong. But secondly, that the weekly workload and the ability to commit to the program is there. We've had a 97% completion rate in the program. And like we are stunned at the feedback that we get. When we look at the feedback on the learning experience and on, you know, learner support, etc., it is always 100%. It's an incredibly popular program. So I am going to finish pretty shortly and move to questions. So, you know, to summarize, it's a 21-week program with breaks in the middle. Works out that we will, you know, we'll start the program at the very end of November, and we'll be finished with it by early summer. It's open to medical doctors and nurses. The award that you get is a diploma from the College of Physicians and Midwives. Yes. The diploma that you get is from the College of Physicians. It's recognized, you know, that is recognized worldwide. You get CPD or CME as well as the actual award. The fee is €3,000. There are 50 odd of the 75 places for the end of November already gone, so it is filling up incredibly fast. We expect it to be oversubscribed. Our other programs with RCPI are oversubscribed every time we put them on. So we're expecting this to be no different. So I'll stop screen share, if only to, you know, not have PowerPoint for any longer than we need it. I saw a couple of questions come in. One, I think, is about, sorry, Rebecca, one was about the part one MR COGS.
Did we answer that to a certain extent? Yeah, but you go on ahead, dear Mr. So you might clarify further.
Yeah, so this obviously if the part one of MRCOG is that's part of the current pathway in Ireland to do your MRCPI part 2 exams. This diploma is the first stage of what is, and it's still, the rest of it is still going through approval. It will eventually lead on to, there'll be a postgraduate certificate and postgraduate diploma afterwards. And the postgraduate certificate that's to follow this program, which is an additional kind of 7 or 8 week module at the end, that should, I should say, not will, because it's not approved yet, but that should grant, the plan is that will grant exemption from the part 1 MRCPI exams. So that's kind of the context there. And Rebecca's put the detail of what the PG cert will look like into the chat, but that is still going through approvals with both RCPI and QQI as the higher education authority in Ireland. So yeah,
there was a question as well earlier. I don't think we failed to answer it. Just remember, I've seen it. Just I can't remember offhand what the CPD points recognition in the UK is for this program. It'll be the same for pediatrics, right? Yeah. So RCPI will grant the 44, and that is recognised in the UK. There's mutual recognition between the Royal Colleges, so it'll be 44 points in the UK. Is pretty standard, and then. So let me see what else is here. International sponsored doctor can answer. Okay, Nora, I
I will have to look into your query there. I think that's pretty specific about getting into higher specialist training in Ireland. So that's probably outside the scope of the call this evening. Master degree in health and social care. Patricia, it might be unlikely. I'm not certain, Patricia. Again, we'll get one of the education advisors to get all your details from you, and then look at that with the college, if that's okay. And let me see what else is. Yeah, no, you don't have to be IMC registered to come on the program. Just looking up the list of questions. Is there anything I've missed out on, Rebecca?
I think we've answered most of the others. Just to I know we've talked a lot maybe about Irish funding and IMC and things like that, but just to let you know that always over 50% of our students are international on this program, a good majority from the UK, Gulf, Malaysia and Australia. So it really has a very wide reach, and we intentionally build and design and develop our programs with a global audience in mind. We will nuance sometimes in our discussion based on more local regs, but in general it has a more global delivery and curriculum in mind when we develop this program.
And similarly to that, the faculty in the program will be a mix of consultants from Ireland and from the UK and from the Gulf region as well. So it has an international faculty to match the international audience. Afolabi is asking, yeah, there will be more runnings of the program in 2022, obviously. So it will run 3 times a year. But so we're recruiting for the upcoming intake, but there will be more in 2022 as well. So you've no fear there. Yeah, I think Rebecca, I think we've covered everything off in
just to really
short space of time.
Yeah, we do appreciate that, particularly midwives, but all clinicians can have very unusual shifts and challenging day-to-day workload. So even though we absolutely would love to see, and it's a highly beneficial, and there's direct correlation between the live tutorials and your final grade, we do understand that sometimes your work commitments may stop you from attending some of those tutorials, and they are totally recorded, and you can watch them the year after if you do miss one. So it is flexible. But having said that, as I said, you will enjoy the program so much more if you are on those tutorials. You get to know your cohort and your group very well. And there's a wonderful, I suppose, the most important thing about distance education, sometimes it can be very hard to remain focused and motivated when you're isolated and alone. This program is built with the fact that there's an awful lot of interaction and an awful lot of touch points with your tutors, with your mentors, with your program managers, and the whole academic affairs team. So you really won't feel like you're doing one of those quite frightening downloadable PDFs, talking heads, distance learning education. This is very interactive and very enjoyable from that perspective. I will say just, I know David has said it already, but this program and the RCPI programs in general have a tendency to be highly popular, and this is the inaugural launch of this specific iteration, and that's starting on the 27th of November, and we are 3/4 full. So there are limited places available, but we do have some left, and I'd love to see some of you on the program. So if you are interested, I know Josh has put in the application link and the deposit link into the chat, but if you have missed it and you want some more time to digest, we will send you the email tomorrow with the recording of this webinar, and also with a link to the application form and the link to the deposit payment. And our education advisors will reach out to you and just see if you have any more queries.
Yeah, and there's a couple more questions after coming in and chat there, Rebecca. So, and they're slightly related. So if there's someone saying, effectively, will this diploma add to my CV, even if I've done part 1 of MRCOG already, and or will this program get points towards specialist training? And I think if I think to the conversations we have with our faculty who are all involved in the selection of residents for training programs, if they are looking at 2 CVs and one person has demonstrated a commitment to a clinical area and has undergone a qualification and has achieved a diploma, that absolutely stands head and shoulders above a CV that someone hasn't done that. You're talking about I suppose a demonstrable level of ability from that's attested to by the Royal College. So that absolutely that will add to your CV. The Part 1 MRCOG, that is a recognised standard as well. But no, I'm a very firm believer that all education is beneficial. And I think the other piece that I go back to is that I think there is a difference between an education program which is facilitated, that's tutor led, that you explore the topics, as opposed to revising content for an exam. I think that they are two very, very different things, and I think what you get out of them is I think there's a richness of the experience that you get through the education program. So yeah, we're very conscious of everyone's time, and the education advisors will reach out to everybody and chat you through any specific questions that people have, and we very much look forward to seeing some of you in the program at the end of the month.
And Mia has asked a similar question again, just how do we upgrade to the PG cert? It is an additional module that it costs €600 and will be coming in 2022 as an add-on to this program if you want to do the PG cert, which will be on the framework, and then get the MRCPI recognition Part 1. That is possible with the PG cert. So you can have that add-on for €600.
Yeah. Brilliant. So thank you all so much, and look forward to seeing you on the program.
Thank you so much, everyone. Take care.
Cheers. Bye.